ANZSOG asked me to talk about the shift towards citizen-centred services in the Australian public service, together with switching on and doing a little bit of the theory involved with this, but also some of the international developments. So I'm going to flit a bit between the on-the-ground practice and the theory around it, and hopefully it won't be too incoherent for you. But in doing so, there are a couple of questions that I think we need to consider. The first is, how are we changing the way we engage with citizens in this country? And secondly, is what we're doing enough? I think it's important to consider the key opportunities and challenges to realising truly people-centric services. We not only need to raise the standards of our interactions with the community, but we also need to radically rethink how some services might be best designed and delivered. So let me begin by telling you some of my own experiences with service delivery reform. In doing so, I'm going to touch on some of the main drivers of that reform and some of the structural changes that we've been making nationally, designed largely around facilitating community engagement. I think many of you would know that a few weeks ago, on the 1st of July, we combined federally 3 great Australian public service institutions: Medicare Australia, Centrelink and the Department of Human Services, which incorporates the Commonwealth Rehabilitation Service and the Child Support Agency. And they came together to form one Department of State. And this, to me, is a real milestone, because the new department is going to give policy clout to service delivery, with service delivery now for the first time, I think, being recognised as a valid policy stream in itself. The new department is designed to provide new ways of allowing people to access health services, income support and child support. What it's about is merging the services so that they're refocused to deliver better results for people, having the information and tools available with our staff so that they can assist people to gain access to a range of community or other services that might better meet their needs. Australians feeling that they're able to work with this department to provide new services that better meet their needs, to devise new services that better meet their needs, to share in the design of those services and advise them on the best method of the delivery of services to them. And the final thing is, what we sought to do was transform the department's operational arrangements, both electronically and procedurally, to provide the basis for all of this to happen. This merger is large by any standards, locally or internationally. Some 40,000 people work for the department. There are about 550 offices nationwide, and the organisation delivers about 170 Australian government programs and services. In effect, it comprises about 1/3 of the Australian government's budget. And in reality, the department is the face of the Australian government in the Australian community. So with this reorganisation, we've got a major opportunity to deliver enormous change. And in my view, this signals, I think, the biggest change in social policy in this country in the last 20 or so years. And it really is a direct response to the need to put the people that we serve at the centre of our work and to build structures around them. It would be no surprise to people that today Australians and New Zealanders really do expect quality services from their governments. They want reliable advice from expert staff and convenient online access. We expect quick, convenient service for straightforward things like pension changes or Medicare payments or entitlement adjustments, but we want a higher level of service that delivers results when we're in need or when we're in trouble. We expect to be treated like individuals with particular needs rather than to be treated like everybody else and told to take it or leave it, or to go somewhere else to get something that we think we need. We expect to be treated with respect and courtesy, and we expect to be able to trust the public service to be there when we need it. In effect, we're after that thing that Christian Basin talked about, a system that works for them. And indeed, that's what we had in our heads when we devised this merger of these organisations, and we established, or the government established, a high-level approach to this service delivery reform, which runs under the tagline, easy, high quality, and works for you. To deliver on this kind of bold promise is really pretty challenging, and I think people were asking questions this morning about how do we do it? Well, you do it systematically, thoughtfully, and respectfully. You must try in all contexts to align people around the vision and the approach and to make that a priority. In our organisations, we were extraordinarily lucky because I had to say we had 40,000 people in our staff who supported this change. We also found when we surveyed them directly that their values also reflected the kind of change that we wanted to introduce, and that made it easier because we knew our staff wanted this reform. To make a large reform like this work, you need a plan, and boy did we have a plan. The plan started off with focusing on fixing the current blockages to service, that bit that we call easy and high quality, but is so fundamental to getting right and providing minimum standards of service before you provide anything that really gets to the higher level of service that we're after. And as part of that, the vision involved integrating all of our systems and all of our processes, and I'd be fibbing to you if I said we'd done that yet. It's still in prospect. To make these things work, you need active leadership, persistence and determination in your leadership team. To us, that translated into a senior team leading Centrelink Medicare and the department, or the then department, who were united in focus and direction and in the planning framework. It also translated to senior people on the ground who we call service leaders, who are directly responsible for community engagement and repositioning our services around the Australian community's needs. And on top of that, we've got hundreds and hundreds of people who put up their hands to be change agents, and they're called transformers. And they have the transformer machinery, they have everything, but they make this live on the ground. And it's that kind of leadership across organisations that must occur if this is to work. The final thing I heard discussion about this morning was, well, how do you make these small bits of engagement grow? Well, you need a national rollout. And that's what big organisations like this are for, and that's why planning and orchestrated administration is fundamental. Now, for all of this to work, it required us to have at the forefront of our thinking the need to progressively take this portfolio to another place where we could truly put people at the centre of everything we do. With that, the design and delivery of services would start to become outside in, with Australians telling us what they want and need, as opposed to the more traditionally internally driven model where we tell you what you will get. And we also specifically sought to develop new service offers based around people's life events and their local issues, particularly areas of local disadvantage, and not the same sorts of silly procedural issues that have dominated some of our programs over the years. So that Australians could tell us what they wanted, the portfolio conducted a series of community forums across the country to gain their insights into what we should deliver. And that was our first step in the commitment to the co-design of service and to building mechanisms to actively engage the people who use our services in designing them as well. The forums gave us a better understanding of how people experienced our services, the obstacles they faced, and their daily frustrations. It also showed the complexity of the issues they faced and the diversity of Australians. And it was very clear that they have different views about what they want from government services. Many of them, for example, want to have as little involvement with government as possible and to make everything happen behind the scenes. Others want a lot of support from government. But 4 key themes came out in these discussions about their expectations of service delivery. Firstly, people said, make it about me. As much as possible, they wanted services to be personalised and tailored to their individual needs at different times in their life. Secondly, they said, connect me when it counts. They were looking for better coordinated services that would deliver results for them, easier and quicker access to these services, and services that linked between different tiers of government and community groups. Thirdly, people wanted things to be clear and simple. They were in search of good communication and good information. They wanted to deal with staff who understood and had empathy for their circumstances, and they wanted simple processes and forms and intuitive online services. And they said, give me flexibility. People were looking for easy and appropriate access. They didn't always mean online services, although that's now the preferred way of engaging for most Australians. Some people still prefer face-to-face options, and most people prefer to talk to someone when they're dealing with sensitive or complex issues. And naturally enough, it's when things that get complex that we must really work to meet people's expectations. One participant at this forum described their experience with our portfolio to date. If you just have general stuff, it's good. The problem is when things fall down. If things get complicated, that's when it gets bad. I think that also highlights that policy officers need to have a clearer sense of the service delivery implications of their work, because what works logically on paper doesn't always work smoothly on the ground. Naturally, these sorts of comments merged into our suggestions for improvement. And 2 of the most important ideas that emerged for improvement were personalised service delivery, including a case management approach, and linked up services with the idea of a one-stop shop. Now, these aren't radically new ideas, but they do tell us that we were on track with our assumptions about people's expectations of us. And I think they also amplify that it's important for people on both sides of the system to have an understanding of each other. And Aboriginal people in particular want face-to-face services, and an Aboriginal participant said this to us: they don't know what's going on in the outside world, and we don't know what's going on in the inside. They need to come out to our communities and experience what it's like for us, to live like us and to make it real for them. It should be part of their training. And that's really exactly the challenge that we've got. Now, these forums were just one of the examples of the sorts of community engagement approaches we're looking at. We've agreed with several councils in Victoria that they will run town hall meetings for us. Our staff are to be directly engaged at the local level with the community, led by our service leaders in these discussions. We've had an enormous amount of engagement with community stakeholders, so various not-for-profit groups who've given us their views, and we've tried to bring all of those on board. And I think what I'm saying is that I don't think there is one model that makes this work. You try and engage as effectively as you can with as many players as you need to for the particular thing you're dealing with. Now, I said I'd been asked to talk a little bit about the theory, and you all know that there's an enormous amount of debate about citizens, customers or clients. Now, frankly, I don't give a damn. I see what we do as really being putting people at the centre of what we do. But most recently, the Australian government has tried to elevate this debate to a discussion about citizens.